the most common questions I get asked is, well, what kind of tools do you use? I grew up in a house that did mostly construction, where we used hammers and nails and screws, and I always joke around with my dad and all of my construction family that my tools cost twice as much, but are or half the size. So let me introduce you to what's in a surgical pan, okay? So this pan is something that comes sterile, all right? And this is called a plastic pan, which we use basically for all of our cases that are plastics. And then we have lots of individual instruments that we use for specific cases. So this is a pan that we use to place water or tissue in. These are all little bowls that are commonly used again to either to catch water, place fluids in, or some of the local anesthesia that we use during the surgery. This is what I call a deaver, and this is used to actually retract some of the tissue. It looks very medieval, doesn't it? Used to retract some of the tissue during a tummy tuck, so it's a really important piece of equipment. Then we have the infamous nipple markers. So you can see these guys come at different sizes, right? And so they're used to actually measure out the size of the nipple that we'll use, like say in a breast lift or a breast reduction. And they have a sharp edge and kind of a non-sharp edge, and they each come with different numbers based on the different sizes that we want to design the nipple at, okay? So these actually are called Army Navies, and the purpose of these are basically just for retraction of tissue. I don't know which side is the Army and which side is the Navy. I guess I'll let you answer that question. Next, we have one of my favorite instruments, which I call this the push me, pull me. I'm sure there's a much better name for it. But this comes with two little sharp edges, and the purpose here is to allow us to retract the tissue, and then what we can do is clamp down on the tissue and determine how much we're going to actually cut off. So this is a really safe and effective way to get the patient's tummy, for example, during a tummy tuck, as tight as possible, but at the same time not make it too tight so you can't close it. So this is one of the most important pieces of equipment that I use on a regular basis. This is just another small type of retractor called a Richardson. They're really tiny, depends on kind of what you're retracting. And then we have this device, which is what we call a Yankower. It's a little suction to help suction blood and fluid. In addition to that, we have a ruler, very important. Then we have these, which are called little iris scissors, and these are meant to just cut really fine tissue, so they're really sharp. And then additionally, we have little hooks, right? So this is just a single hook. These guys are called sens, and they come with a sharp edge to retract tissue, or a blunt edge also to retract. Now, there's a variety of different types of what we call pickups, or things that we use to handle the tissue. And so I'll kind of go over those. This is called an Atson Brown, and what you can see if you look at the tip here, if I can zoom in on there, the tip is a little bit different than, say, this device here. So one is like a longer, sharper edge, and so they just grab tissue a little bit differently with different amount of trauma. So depending on the type of tissue, we'll use that. So we have a couple of those. This is called a Ferris Smith, so this is a really big one, used to grab bigger tissue. Here's a DeBakey. Again, it doesn't have any sharp edges, so this is meant to be really soft for like blood vessels and nerves. And then this is probably my favorite. These are called the power pads, is what I call them. And they're meant to handle, this is probably what I use 99% of the time, which is probably my favorite. Now what happens is we actually get into the types of clamps we have here. And so we'll kind of go over that. These are tissue clamps, and this is meant to kind of clamp tissue sharply. So if you misbehave during surgery, this is generally what gets clamped on your finger. Just kidding. And then we have something called hemostats, which again just used for retraction. For grabbing, whether it be the tubes or for dissecting. Then we have Alice clamps, which again is also meant to grab tissue. Okay, just different types of trauma, depending on what type of tissue you're grabbing. Then there's a variety of different types of scissors. So these are all different types of scissors. One is used to cut suture, and then also used to cut bigger suture here. And these are meant to cut tissue depending on how thick or big the tissue is. And then obviously the most important part of our surgery is suturing. And so we have a variety of different types of what we call needle holders to suture different types of suture with different types of needles. And so this is for obviously for bigger needles. This one's a smaller one, meant for a smaller size needle. These are the ones that I use the most, and these are called suture cutting needle drivers. Definitely really helps with efficiency on time, and what it allows us to do is grab the suture, grab the needle, but also cut the suture at the same time if we need to. And then smaller, more petite ones. So anyways, that's what we use. This is a basic pan that we would use, say, like in a tummy tuck. So hopefully you find that interesting.